I saw a patient this week in clinic, and the consultation was quite thought-provoking, and I've been kind of mulling it over since, and I thought I would share because it's given me a little bit of insight into how good doctors or nurses or any medical professional goes bad. And I don't mean like Harold Shipman, Lucy Letby, serial killer bad. I mean, how do sensible medics end up promoting BS, particularly on social media? And it's kind of unlocked a little bit of a thought process in my head. The intention with this channel is to try and give some kind of unfiltered, unscripted views so you can see how inarticulate I am without a script. This could be a mistake, but here goes anyway. I'm working on a main video for the main channel, which has kind of leapfrogged up the list. I was going to do it a bit later in the year, but it's dealing with medical podcasters and influencers in general, medical influencers in general, but particularly podcasters, and I'll explain sort of in the video why I've selected that. And so obviously for this, I have been doing a lot of research by exposing myself voluntarily to this kind of material, podcasts and Instagram, and not so much TikTok. I value my sanity too much, but of course, you know, I am aware of stuff there, and it just felt like it's really just unprecedented. Like it seems to be more than ever. So I thought I would bump it up my to-do list of videos, but it is a big ask, and I think I'm going to have to try and cut short the you know, how wide I want it to be just to get it out there, because there is too much to go into. But one of the areas of medicine, I hesitate to call it a field of medicine because it isn't, but you may not be familiar with the term if you are not in the wider field of medicine, which is something called functional medicine or lifestyle medicine. And this is just the latest rebrand in a kind of loose collection of ideas that was previously called integrative medicine or holistic medicine or complementary medicine. And it's not exactly the same as alternative medicine, but there's a big overlap between the two. And some people who are devotees of functional or lifestyle medicine may bristle at me making that comparison, but I believe it is legitimate. So functional medicine, for those of you that haven't heard of it, classes itself as a separate field of medicine, but I would contend that it really isn't. If you look up the sort of British Association of Lifestyle Medicine or any of the different countries that have similar things, it will say things like exploring how important diet is to health, exercise, socioeconomic factors, stress, relationships, and it will consider these factors in treating and causing disease. Which all sounds entirely reasonable. In fact, I would say that is just normal medicine. You know, if you are a doctor, so why am I bringing this up? Because it is massively overrepresented in social media. You'll see so many more social media influencer medics talking about lifestyle medicine than clinical doctors in real life, because it's kind of cool, it's sexy, and you know, the whole influencer culture very much revolves around that kind of image of, you know, people talk about lifestyle influencers, and the medics kind of cross that boundary between lifestyle influencers and health influencers. And, you know, this is just reflected in Andrew Huberman last week saying that it would be legitimate to question a doctor's expertise if they didn't, and I quote, look or sound healthy and vital. I don't know what that means, and it, you know, certainly suggests that disabled or older doctors shouldn't be listened to. But this isn't, he's not the first to say this. You know, this is a common trope amongst these influencers that, you know, they need to sort of embody, which is not a bad message to want to embody health. I mean, I certainly take that on board myself, but the flip side of that is not to suggest that, you know, the people that you listen to about health need to be themselves paragons of health for any number of reasons. Anyway, I think I'm digressing slightly from the point, but lifestyle medicine, functional medicine is hugely overrepresented in social media. And people will say, you know, I'm a doctor that considers the patient holistically, and I think about all these different factors. well, congratulations. That doesn't make you a lifestyle medic. That makes you a good, normal doctor. Now, this is not to suggest that you haven't had a bad experience at a doctor who didn't go into those things, but in modern medicine, and if you know who I am and the kind of stuff I talk about, I am a vocal critic of modern medicine, so I'm not at all suggesting, I'm not defending the practice of bad medicine. But if the doctor didn't go into, exploring the intricacies of your diet and your exercise and your job and your relationships, that's not because they don't care. They know very well that those things are important, but they, in the UK, the average consultation with a GP is 7 minutes long. They simply don't have the resources or time to go into that, even though they may want to. So lifestyle medicine attracts, I think, a lot of people in. And the thing that unlocked in my head about the consultation this week is that this is a gateway drug. And I have described it in that way before, a gateway drug for normal medics to enter into quackery, to go from saying quite sensible things. And if you look at your favorite quack influencer, you just go back a few years, and I promise you their posts will probably be quite reasonable. But functional medicine, lifestyle medicine is this way that draws in particularly younger, newer doctors, who are, again, overrepresented in social media because, let's face it, we all like to follow hot influencers. I think maybe that was too much disclosure, but let's move on. And the practices of functional medicine are often, they start reasonable, like talking about things that are perfectly harmless, forest bathing, cold plunges or cold showers or red light therapy. But these are not scientific things. They're perfectly nice, sure, and I'm not at all criticizing if somebody wants to recommend those, but they are not evidence-based in the same way other medical treatments are. And where they can be harmful is if you give the impression that other medical proven treatments are not necessary because you're recommending these lifestyle measures. I've had patients come to me in clinic with uncontrolled hypertension that's caused organ damage because their functional doctor had told them that they can modify this simply by cutting out a certain food group from their diet, or patients with hugely elevated cholesterol who were told that they don't need to be on a statin, they can modify XYZ, and they've come in with huge heart attacks. So, it's not a binary thing. It's not like totally in favor of pharmaceuticals versus completely in favor of lifestyle maneuvers and nothing in between. In fact, the people who are very good at that in-between ground is the standard family doctor. So the lifestyle medicine that I've described as a gateway drug, the reason I was particularly struck by this consultation this week was it was a young woman with her boyfriend, a partner. I guess she was, mid-30s, early 30s, very active, fit. She used to run half marathons, no past medical history at all until 2022 when she got COVID. And then after that, she's had long COVID. And they were lovely people. I enjoyed talking to them. But almost before they started speaking, I could see they were both kind of crestfallen. And I see a small proportion of long COVID patients, those that have cardiac manifestations that are so bad that their GP feels they need a referral on to me in specialist care. And I had already done some investigations on this patient prior to them coming in. And, obviously they just wanted some reassurance that there was nothing else going on with her heart. And I'm pleased to report to her that her investigations were fine, but they often are in long COVID. And they just, asked, is there anything you can suggest? But they're smart people. They'd already done a lot of research themselves, and they already knew the answer. They were like, I know you're probably going to say there isn't anything, but is there any treatment you might have heard of, even ones that are not necessarily in the mainstream compendium of medical treatments? And that's when it hit me, this kind of pang, this, temptation to come out with something that may just give her a bit of hope, something that maybe is a little bit offbeat, because what will happen in that moment, she will get some positivity, she will feel better, I will feel better, she will think I'm super doctor, all these other doctors she's seen haven't been able to say anything, and then Dr. Francis suggests, celery treatment and sauna therapy and I don't know, wearing some fancy wearable. You'd think I'd be able to come out with wellness nonsense more easily, but I'm sure you can fill in the blank with your own craziness that you've seen. And I think I'd struggled before to see how doctors end up promoting bullshit. And I guess I got it right then, because I was so tempted to say something. I guess because I've been watching all this stuff recently, it was in my head. And I'd said, if I'd said to her, actually, I have a patient similar to you, and traditional Chinese medicine and ear seed acupuncture, if anyone's watched Dragon's Den, they'll know what I'm talking about, maybe could help you, because it helped my other patient. And what do doctors really want to do? Fundamentally, what's the doctor's main aspiration? Is to make a patient feel better. So I could have done that. I could have made her feel better, but it would have been transient. And she would have gone away, tried whatever I had suggested, maybe spent some money on it. And I can't say it would have never worked. You can't rule anything out with 100% certainty in medicine, but it is almost certain that it wouldn't have worked. And then she would have been back to square one, or worse. And then if I was irresponsible, she'd come back to me and I'd suggest something else, or, come up with some test. Say, well, we should check your selenium, your magnesium, your zinc, your vitamin D, and then prescribe some supplements. And, I guess what I'm trying to say is there are some people out there to enrich themselves that are the kind of typical grifters. But I think most people don't start like that. Most medics who you may see promoting rubbish probably started with good intentions. And they just wanted to try and set themselves apart a bit and come up with something to help a patient that maybe they couldn't help using conventional means. And what we have to do in those situations is accept that modern medicine has limitations and avoid the temptation to start promoting untested stuff. And in this situation, they probably said something on social media, these influencers, and for a number of reasons that I'll go into in the main video, audience capture, financial conflicts of interest, fame, they then get positive feedback for this quackery, and they start sliding further and further down from the functional medicine helter-skelter into full-blown quackery. So I hope that wasn't too much of a ramble. I just thought I'd share these thoughts I've been having while making this video, and after I spoke to this unfortunate young woman who ultimately was just mourning the loss of the life she once had. She was obviously a very active person and has now been rendered in her life's completely changed. And I guess maybe I saw myself, she was only a few years younger than me, and I maybe take my own health for granted as well. I'm lucky that I've only really had sort of musculoskeletal problems with muscles and joint issues, but nothing serious. And she probably thought the same. And then one day, out of the blue, she got hit with this. And, there are these conditions that we don't understand well in medicine, long COVID, chronic fatigue syndrome, that we treat badly. And I think these are the grounds where probably no doctor likes to deal with frustration. They speak to a patient like that, and they succumb to the temptation that I almost succumbed to this week just gone. So I hope that wasn't too disjointed, and look forward to some more rambling, unscripted nonsense soon. I don't talk medical bullshit, but I do talk plenty of bullshit. This is not my flat.